More than 880 people have died from Ebola in Guinea, Liberia and Sierra Leone. And the worry now is that as more people contract the disease, it will start to spread outside West Africa. An American doctor who was infected with Ebola has already flown back to the US. His colleague also has the disease. She's expected to arrive back in America on Tuesday. Symptoms of Ebola include high fever, headache, vomiting, diarrhea and bleeding externally and internally. On Monday, doctors at Mount Sinai Hospital in New York said a man arrived in the emergency room showing Ebola-like symptoms. He's now in isolation. Officials said the man's symptoms could be from any one of a number of diseases, and they won't know for 24 to 48 hours whether he has Ebola or not. The fact that there are 2 people with the disease and another possible victim on American soil has caused alarm in some places. But Dr. William Schaffner, who is an infectious diseases specialist at Vanderbilt University, says there's absolutely nothing to worry about.
This virus is not one that's readily spread. It's not like influenza. You have to have close, prolonged contact with person's body fluids to acquire the infection. So I think there's absolutely no chance that it's going to be embedded into the United States.
The $200 million pledged by the World Bank will be split between the governments of Liberia, Sierra Leone and Guinea, as well as to the World Health Organization. The cash will be used to pay health workers and help those who are sick. Some of it will be used to fund a campaign to inform people about the facts of the disease. This payout still has to be approved by the World Bank's Board of Directors, but the hope is that this is the first major step to bringing the Ebola outbreak under control. Wendy Urquhart, BBC News.